Good afternoon, it's Mark Larson, Public Health. I'm going to talk about school opening. So as you probably noticed, there's more students around in town. That's because the off-campus students have started to come to town. This weekend, 2,100 on-campus students are going to come to live in single rooms in the dorm. They have about 8 to 10% of their classes are going to be in person and everything else is going to be online. Those students that came back are coming back because they have apartments that they're already paying for, those type of things. And that's a big lift for Central to be bringing students back. They've been working hard at doing that, and they hope to be successful with their plan. It's kind of the same thing that happened with Kittitas. Kittitas School Board, it's the school board's responsibility to decide whether to open or not open. OSPI and the Washington Department of Health, as well as our regional departments of health, had some metrics involved that said that it was risky to open. That was the incident rate of greater than 75 cases per 100,000 per 14 days. And at the time that Kittitas made the decision to open K through 2 in person and 3 through 12 in a hybrid, we were at just under 100 cases per 100,000. That was risky. We at Public Health said we do not recommend that you do that, but it was a recommendation, not a mandate, and they made a decision that working with us on their safety plans that they felt like they could do that. Now our rates are below 75, so we'll just kind of have to see how that goes. Other school districts have chosen that it wasn't an appropriate step for them to take. They're being more cautious. They are bringing back the kids with special education needs, some kindergarten kids, trying to make things work the best for their community and seeing how the numbers go. Those incident rates go up and they go down, very different than the number of cases. Incident rates really are the number of cases that occur over a period of 14 days. We don't take the last 14 days, we go back 10 days and start counting there. And that allows us to compare other regions. It allows us to compare Kittitas County versus King County, for example. So since there's just under 50,000 students or residents in Kittitas County, you multiply those cases times 2 and it gives us the incident rate, which is the number of cases per 100,000 people per 14 days. And that gives us an idea of risk. It gives us an idea of how many people in the community have had COVID-19 over those past 14 days. So that's the metric we're using to decide about opening schools safely. That metric is not applied to post high school education. So Central Washington University, Pullman, WSU, they follow different guidelines. And as you know, preschools follow different guidelines. So you're going to see a lot of preschools expanding because they know the need is there, and they're all bringing safety plans by us, and we are working hard with them to make it as safe as possible. So again, incidence is what you want to look at. It's a rate. The rate of cases over 14 days per 100,000 population, and allows us to compare Kittitas County with Los Angeles County, for example. So I hope that helps, and we'll talk to you on Friday before the holiday weekend. Thanks a lot. Bye.